Hello, everyone, and welcome back to Bridge Builders. I have been receiving so many requests related to MHA in the United States in terms of the application process, skills required to fit in the field, the scope, and the opportunities this field offers in the United States. To discuss all this today, we have Dr. Indrani Pasumarthi, an Indian trained dentist who has made a successful transition into the American healthcare system after pursuing her master's in healthcare administration and informatics. Over the years, she has worked with various healthcare organizations in the space of program management, healthcare process improvement, healthcare finance, data analytics, etc. With a wealth of experience and knowledge, she brings a unique perspective to diverse career options available in the US for foreign trained dentists. She's equally passionate about mentoring our fellow dentists who may be facing similar challenges in their pursuit of higher education and career in the United States. We had a long and extensive conversation with her, and I'm going to divide this video into three parts. Part 1, the application process for MHA. Part 2 will focus on how you can excel in your MHA program. And part 3 will talk about the opportunities after MHA in the United States. So, if you're planning to pursue MHA from the US and want to create a robust application, then today's video is for you. Hi, Dr. Indrani. Welcome you to our channel, What After Dentistry, to talk about how to pursue MHA in the US and what are the opportunities and scope of this field. So, welcome you once again.
Hi, Dr. Saini. Thank you very much. I appreciate your opportunity for me to be able to help other dental fraternity to pursue their career further after BDS in the United States. Thank you.
So, before we get into the formal discussion about this particular field in the US, I would like to know what inspired you to do MHA and only MHA in the US and not other healthcare, options that are available.
Yeah, so this was a few years ago, and at the time when I first finished my BDS, my intentions were to go ahead and work on having my own practice. However, you know how like our dental education system, it was great with helping us with the clinical knowledge, but I did not think I had enough business side of the knowledge skill set to be able to own a certain dental clinic and go forward with it in the most efficient way possible. And I was looking at different options at that time to pursue my career. And then I landed upon different options here in the US. There were certain courses in India as well. But given to the practical curriculum and the scope of the course itself, I decided MHA would be a good place for me to learn the different aspects of healthcare that are there to it. And I also was excited to learn more about how the West does the things, right? Like the technology wise, healthcare wise, there were a lot of advanced things here in the West. So I wanted to learn those and kind of bring that back um, somehow into the dental community in India. So that's how MHA happened.
That's great. So, it's very interesting to see that there are a lot of other healthcare options as well in the US. So, how would you guide, because we also get a lot of questions in terms of whether I should go ahead with MHA or whether we should go ahead with MPH or, health informatics is now the upcoming, there's so much talk around digital healthcare and all of those things. So, first of all, what are the various other healthcare, careers that are available in the United States? And how can one choose, which is the right, career field for them?
That's a very good question. So, in my opinion, I think it's the students when they are moving from BDS to maybe a different profession or a different career choice. I think it's very important for all of us to just sit down and think, where do you find your interest? Why do you want to pursue something? Where do you see your skills aligning the best? Especially when you're trying to move to a whole different country, I understand there are so many different factors, right? It comes with moving away from home, learning a lot of new things. The whole change itself is not easy. So I would suggest any of my even my juniors that I talk to, I suggest them to really think about what areas do they feel they would best fit in. some of my colleagues, they're amazing with informatics. Okay, they can learn coding, they can sit and they can work in informatics for a long time. But I mean, inherently, we are all in sciences, and we all know how math is for us, right? So just depending on what works best for you and what you think is will keep you motivated and inspired to pursue further, and that will give you job satisfaction. I think that is the first thing to really focus upon. And once you have that sorted, I would say, well, pretty much any MHA, informatics, public health, all of them currently have large scope. And even considering the recent pandemic, public health and public health analytics are booming a lot. So I would say like any career would have good, fruitful outcomes. However, everybody really needs to figure out what works best for them, what are the skill sets that they want to gain, and what profession will give them ultimate, satisfaction and happiness.
Yeah, right. I think that's very correctly you've put it together, because just because somebody did it, my senior did it, or one of my batchmate has done it. I think these are majority of the times, you see, these are the reasons, that
True.
as in Hindi we call it like a bhed chal kind of stuff that goes. So,
Yeah,
yeah, very correctly you've mentioned one should definitely look into their own skill set, what they are good at, and
yeah,
then try to explore that further in terms of pursuing what
yeah.
career they would want. Because I think pursuing masters, again, you cannot make the same mistake that you did with your graduation. Maybe you opted BDS because you didn't get a MBBS seat, or maybe that was not your first love. Yeah, so you can't do the
You
same
have,
mistake
yeah.
again.
You hit
Correct.
the nail on the head. That is very true. So that is also some philosophy that I really go by is when we were starting out BDS after the high school or after the training, that was the time where, we didn't have a lot of choice. There was choice, but at the same time, it was also the trend, right? Like you get into sciences, biology, and then you want to become a doctor. So MBBS, if not BDS. There are definitely a handful of people who pursue dentistry as a career itself, as a choice itself. They invest a lot into it, and there are some great dentists who go down that direction. However, that's a very good thought, because after 6 7 years of training in dentistry, now you also have the world is open to you. You have grown up, you've matured in your mindset, and you have some basic knowledge to grow upon. So yeah, I think that's a second chance in life that you'll get, where you can really choose what you want to do. Even if it's dentistry, you have the plethora of things that you could do. Like here, there are some other, we can maybe do another session on that. There are different oral sciences you can get into as well. But lately it has just become a trend culture where, my seniors did this, their seniors did this, so you eventually end up following the same trend. So but I think it's very important for each candidate that is coming out of BDS to be mindful about, you know yes, there are 10 different things out there, but what works best for me?
Correct.
Where do I see myself shining? So that those are some really driving thoughts that I would recommend all the candidates to start with.
Yeah, correct. Absolutely correct.
Yeah.
So moving ahead with our discussion, like I would like to know, in terms of what is the application process like if one wants to pursue MHA in the United States, how should they start?
So currently, there are lots of resources available. As you know, there are different websites, different consulting firms that helps the students in this direction. But my personal experience was that when it was a few years ago when I started this process, I didn't have a lot of resources in terms of consultancies that were dedicated to healthcare. A couple of people I spoke to were more inclined towards the engineering masters or masters in informatics that you might use in healthcare, different elements like that. However, I think there's much more to this. There are different courses and there are different universities that offer um, different kinds of programs. So I personally feel everybody should uh, go through this and be an active part of their application process. Don't rely upon the set stories, right? Don't rely upon the telltales of consultancy trying to tell you, these are the 5 universities, apply here, or these are the 5 programs, apply here. I would rather say you sit down, you take a list of universities, see what works best for you. And the application process usually involves, so all the universities, right, they publish the program on their website. You could go there, you will find the application process information right there. So you can send out all your transcripts, and you can build your profile, have your resume ready, have your letters of recommendation ready, build all of these together. Maybe a university might need a GRE, so you have to pile all this up together first. And there would be some deadlines that you have to be mindful of. So depending on what intake you are coming in for, like be it fall or spring, you could choose certain timeline and plan accordingly, and then send out your applications. um, yeah, I think that's how the major process is like that. But then again, picking the universities or picking the kind of program, it's a very personal choice. You might have some geographical preferences, or maybe not. But yeah, so I think in summary, the application process is more like collecting all the material you need to send out in an application. It might be different from a university to another university. So making a checklist of all those things, having all the documentation ready, sending that out to the university within the deadline. These are the top three things any candidate should be aware of.
Correct. And what are the entrance examinations? Like I feel one would be definitely English proficiency examination.
Yes.
Is that IELTS or is it the TOEFL that is accepted?
You could take either IELTS or TOEFL, any of those would be just fine. And I think recently there are some more English proficiency exams that have been coming along with Duolingo. I don't know exactly, how many universities are accepting all of those, but I know that TOEFL and IELTS are very broad spectrum, and most of the universities do accept it. Some programs also require you to do GRE. Lately, a lot of universities are kind of shying away from that. But I would say that if you want to get into some really good programs and really good universities, I'd say you have to get your GRE done. You have to get your IELTS or TOEFL done. Those are the basic. I wouldn't. Yeah, maybe prerequisites, but not exactly. Maybe the requirements, exactly. That's the requirement for the universities for them to even consider your application. So you need to put in your GRE score and English proficiency together along with the application.
Correct, correct. And how
Yeah.
soon can an Indian dentist start this process? Like, is there any kind of work experience also that is required?
No, I don't think you would need. I mean, any kind of work experience would definitely add to your resume, but not having it will not limit you from getting an admission. You
Mm.
could directly finish your dental school and move here for your master, so you would do just fine. Coming to the timeline, so basically there are two admissions, right? There is a spring admission, there is a fall admission. Spring admissions, the college starts in January every year. Fall admission starts in August. However, fall admissions are the larger. There is most universities do a big, robust fall program, and fall is considered to be a better timeline that aligns better with most of the students as well. So I would suggest, if anybody is trying between spring and fall, fall is a better choice for many reasons. And coming to the application timeline, it would be portals will be open between November December.
Mm.
So if I'm applying for fall 2023, the portals would have opened November 2022. So between November 2022 and February 2023 is your timeline where you have to start getting your application material ready. You should technically finish your GRE and IELTS or TOEFL by that time as well. So ideally, I would say between September, October, November, finish your IELTS or TOEFL and GRE, and then start collecting your application material by November, December. Before the fall admission, you should also have your letters of recommendation, your resumes, your um, statement of purpose letters. You have to have all of that written down, and you can send out the application before February.
Okay.
So that is ideal. That doesn't mean that universities don't take applications after that. There are certain deadlines, and certain universities might also extend it. However, being an early applicant has certain benefits, like you might have access to certain people in the university and talk about scholarships, and certain early applicants also have benefits towards the funding and all of that. So I would suggest the sooner the better,
Yeah.
basically. And then once you file for all these applications, you might hear back from the universities with a decision by April to June. April to June is when you will get the responses, and after which you have to go through the visa process, and you'll be here for the fall, which is August. Pretty much it's the second week of August is when your schools start. So yeah, this is the timeline. So at least 10 months before the admission, or this is the entire process. However, if you want to be proactive, you can even start doing this in the right after the final year of your BDS, before your internship. You can do this process, so you'll not end up spending a lot of time on GRE and TOEFL after your internship. You can save some time there. If you can finish these two things within your internship, you can directly apply for colleges, and you don't have to. Then you will not get that gap between internship and moving to the US. That gap won't happen.
Yeah, yeah, correct. So I think
Yeah,
utilizing the internship year is something that very correctly you've mentioned. One can utilize that, and then,
yeah,
because yes, if I have to sit for IELTS or any other exam, like you said, for GRE, I would need
yeah.
some time after my internship. So yeah, I
True,
think
true,
that's
true. Yes.
so. Moving ahead, like any figure around the cost, any average cost that comes to your mind. How much was the cost for your masters when you did it?
You mean the entire program or the application cost?
No, no, no. Everything, everything.
Okay. So, cost-wise, the breakdown is when you start filing for the application, each university will charge you around, it can be anywhere from $60 to $120 for the application process itself. And then afterwards, the program, again, it depends. There are some programs that will charge you a lot of money, and there are some programs that are averagely priced. So on an average, you can look at anywhere between $36,000, and it can go up to, depending on the program, it can even be like $60,000. There are some like top level universities like Johns Hopkins charges more, the fee is higher. But on an average, you can definitely look at around 36 to $50,000 can be a decent range that you can think of.
Yeah, I think that's quite acceptable. I mean,
Yeah.
anyone can be accepting that amount. Yeah, correct. So,
Yeah.
colleges, coming to the colleges part, any recommendations on those and where one can apply?
I'm glad you asked this question because I personally think that a lot of this well, I don't, it's not that I am critiquing a certain culture in a hard sense. However, if I have to be blatantly honest with you, the a lot of consultancies in India have a tendency to kind of just give a list of colleges and tell you to go there, right? But once you come here, there is so much more to the college. It could be a great college in terms of what they have suggested, but here there is a lot of accreditation programs for the schools, and some schools offer better practical training. So all of this will add up to your resume, which means it might have an effect on the kind of job you will land after. So it's not always just about having a list of schools and just applying to those. It's really upon the candidate that they have to see. You might be spending $40,000 on a program, and you might be spending $50,000 on a program, but what is giving you more weightage in terms of what courses am I taking, what subjects am I studying, what is the am I getting an internship, am I getting practical training in any of these fields that I can add to my resume before I can go to a job. So keeping that long term outlook in terms of like, where do I want to land after this? Your goal is just not to finish MHA in a couple of years and then call it a day. Your goal is to make a career out of it. Your goal is to find a job, and find a job that you would like, and find the job that meets your requirements, right? So thinking in that direction, it's very important to be cautious about the kind of university you're choosing and all the courses that you're picking. Having said that, specifically talking about MHA, there is a accreditation body. It's called CAHME. I can tell you what it means if I remember it on the top of my head. Yeah, it's called Commission on the Accreditation of Healthcare Management Education. CAHME is the board that audits this entire process of MHA, MPH, informatics, MPA, so any master's course that is related with the healthcare field. So they have a website. All you have to do is go to their website and choose the course that you want. For me, it was MHA. So you pick MHA, and it'll give you a list of colleges that are all accredited by them. So I think that right now there are about 90 to 100 universities all across the United States that are accredited by this board. So what does it accreditation entail is that it will tell you that this coursework that the university has built is is legit, is good enough for you to start your career with. There could be like 500 other universities that might be offering similar courses, but they're probably just not up to the standards that are required for you to go out and have a job with. So definitely my first suggestion would be, if you want to find a good college, go to the CAHME website, pick the course you want, MHA, MPH, Masters in Informatics, whatever. It'll give you a list of colleges. Then within that, you'll have the links and you can see what are the requirements for each of the colleges, when does the application deadlines come along, and when do you have to submit the applications, what is the cost structure like. You'll have all the information there. So the source of truth for any candidate that is pursuing any kind of masters within the healthcare field after dentistry or medicine or whatever, I would strongly suggest to rely upon the CAHME website to get the list of universities or whatever. Yeah.
Okay. I think that's fair enough, and that's a very good point. Like, we've had this discussion, on healthcare careers, but so far we have not received this information. So that's a really good point. So all you audience, please make sure that you have all these notes written down somewhere, because this might definitely help you if you're looking for MHA, MPH, or any other master's program related to healthcare in the United States.